Started. Hi, everyone. Welcome to the session of the 2022 Culture of Data Conference. Thank you all for joining us. My name is Allison Rosenthal, and I use she, her, hers programs, and I will be moderating the session today. We also have Jessica Stoker, who is here managing the Zoom and making sure the tech is running. Her pronouns are she, her, hers. You are all muted now, but if you have a question during the Q&A session, please feel free to unmute. You can also use the chat box if you have questions or need anything during the session. If you're comfortable doing so, please add your pronouns to your Zoom name by clicking the three dots in the video square and selecting rename. This session has been generously sponsored by Colorado Access, and we thank them for their contributions to this conference. Here is a message from them. Colorado Access is honored to be able to be a supporter of the Colorado Public Health Association Culture of Data Conference. Data is essential to making informed and thoughtful decisions, and is a huge part of our deliberative process at Colorado Access. We want to sincerely thank our dedicated public health partners in Denver, Adams, Arapahoe, Douglas, and Elbert counties. We don't need much data to see that has been a tough few years for public health workers. We are sincerely grateful to our partners and the partnerships we have forged in COVID work, hotspotting, Health Alliance development, and community partnerships. Viva la public health partners. And now we'll get into our skill building session today. And this presentation is called Coloradans Using Data for Change, and it will be presented by Dr. Rachele Espiritu and Alina Taniuchi. And we feel honored to be able to host a session on how to become better data storytellers, since as we learned in the plenary today, in the keynote today, that's what data is. It's a story. So take it away, Rachele and Alina, thank you.
Great, thank you so much, Allison. We're really pleased to be here with you today. We're going to be sharing a little bit about the Colorado Equity Compass and the platform and how it brings together data and stories for communities and neighborhoods across the state. We're really excited about this platform. It's a way that we see we can democratize data and make it available to residents, policymakers, community-based organizations, state agencies and departments, really anyone. And so we'll talk a little bit about how it's come to be, as well as hopefully leave you feeling like you can navigate the site and use it in the way that you think would most support your work. So again, my name is Rachele Espiritu, and I am one of the founding partners of Change Matrix, and our team is helping to manage the Colorado Equity Compass project. I am based in Denver, Colorado. My pronouns are she, her, and my background is in clinical psychology, as well as culturally responsive and equitable evaluation work. So I'll pass it over to Alina to introduce herself.
Thanks, Rachele, and hi, everyone. I'm Alina Taniuchi. I am also based in Denver. My pronouns are she, her, and I am helping to manage the Colorado Equity Compass from the Change Matrix side. We also have some wonderful partners in this work at the Colorado Health Institute and Consume and Create, as well as the Colorado Trust, who funds this work. So we're just all really excited, even though they're not here presenting with us. Do know that this is a collective effort and really a passion project that we all are just lucky to work on together. So glad to be here with you all today.
Great, thanks, Alina. So if you could, we'd love it if you could take a moment to introduce yourselves in the chat. We are interested in hearing what county you might be based in, and any affiliated organization that you might be working at. That would help us understand who's in the Zoom room with us and what counties you might be most interested in looking at. And I see one of our first people has responded that you're in Pueblo County, which is so perfect because we were going to use Pueblo County as an example. So thank you, Alexis. But yes, if you could all kind of introduce yourselves, we will try to see if we can highlight some of the places that you are based in. So the purpose of today's session is really to share the Colorado Equity Compass. We, just as a full upfront disclaimer, we're not using slides. We will be sharing the website with you, and that's what we really want you to leave feeling comfortable with, going around the website, how to use and the equity data navigator and use that for your own work. We are interested in knowing how you might leverage this data, what you can do to help create some change when you have a better understanding of what the health conditions are in your community. So we'll talk a little bit about how the Compass came to be, where we are right now, and then we'll walk through the website so that you can start thinking about how you can leverage this data. And just looking again at the chat, great to see people who are working in a variety of different counties across Denver. We're always like concerned that we might be a super Denver-centric group, but it's like really diverse. So that's great to see. Thank you for sharing information about yourselves. So part of the reason the Equity Compass started was because we were hearing, or the Colorado Trust in our work with a lot of communities, is that we are hearing a lot that communities wanted some support around getting data that could inform their work. And oftentimes we're relying on census data or data that is kind of more at a county level. So people would know what questions they wanted to ask. For example, how many Black or African-American households have been displaced in the East Colfax, Denver neighborhood? That is a question that we got from one of our communities, but they didn't know where to find the information. We also heard from many communities members that they wanted more granular level data. So for example, El Paso County data wasn't really reflective of what was happening in Southeast Colorado Springs, which, you know, is what often happens, is that people are working in specific neighborhoods or areas or regions, and they just have a sense that what they're seeing in that neighborhood isn't really reflected in countywide data. So that was kind of the inspiration for the pilots project that started in September of 2019. So we had 4 communities across the state that worked with us who were already in some kind of data storytelling process with their community. There were public health agencies, community neighborhood associations, and community coalition groups. And so they gave us feedback on like, here's the data we'd like. How should we get it? What could it look like? How could we make it visually accessible? And what would be most useful for our health equity work? And so their experience helped inform what we have eventually put up on the website. So the other thing we knew was that data on its own isn't always effective for change. We know that data paired with stories is really an important and compelling way to engage people in some kind of action. And it helps people to remember the information better, because stories are kind of the way that our brain works. We respond to it in a lot of neurological ways. And having data paired with a story, paired with good visualizations, has really good impact in terms of leaving people with an understanding of what you were trying to share and what kind of action they might take. So that's a little bit about the behind the scenes on the Colorado Equity Compass. What we'd love to do now is share with you the space. So Alina's going to go ahead and share her screen. And before we go on, I just wanted to invite you all to feel free to use the chat to ask any questions that you have along the way. Allison and Jessica are going to help us monitor that. And we really want you to feel like you can ask us questions or go back a screen if you miss something so that you could get a good sense of the website. So Alina posted this in the site earlier. This is just the Colorado Equity Compass homepage. And this is where we share, well, you can see across the top, we've got major areas of the equity data navigator. We have a resource database. We have a little bit about the initiative itself, and then a contact us space. We also have this site fully translated in English and into Spanish. And so you can just click on there and that'll get you the Spanish version of the website as well. So as you scroll down the site, what you'll see is a little bit about what we do. As I mentioned earlier, we're really trying to democratize data, make it more accessible to people. We're really encouraging communities to tell their own stories, because we know that sometimes the data that we collect in standardized surveys or that are available on census or other large databases don't often tell the real story behind what a neighborhood is experiencing. And so we really wanted to make sure we were pairing the two together. And then you'll see some announcements that that we have. We recently did storytelling awards. I'll talk a little bit more about that later, and share what our efforts are around that. And then we have information just on what social determinants of health are. Those are the indicators that are used in our Equity Data Navigator model. There were 17 social determinants of health that we have in our Navigator. They were all selected because they're available for all Colorado census tracts, and they had correlations to the health outcomes that we're looking at, which are life expectancy and self-reported health status. We are now in the process of updating all the data with 2020 census data, and that will be available in about in a couple of months. So right now what you're seeing are mostly data from about, oh, Alina, is it 2018, 17, kind of some range around there? Yeah. Okay, and so then if you scroll down a little bit further, you'll see the stories. And what we're really trying to do is, this will make more sense once we get into the Navigator, but we're trying to pair the stories that we get from communities with the data for their region. So we're able to tag, for example, there's Southeast Colorado Springs story you see in the middle. If you're looking at data for Southeast Colorado Springs, we want to have this story pop up so that you have something else to reference as you're looking at that information. All right, we're going to talk more about data storytelling later in our session. And so now, is there much more, Alina? We might go into the data model or resources. Yep, we have an extensive resource database on this website as well. We're hoping that we can be the kind of go-to place for different kinds of resources related to health equity and data. All right, so now we'll get into the Equity Data Navigator. And at some point during this session, we're going to ask you to be also go on a little scavenger hunt on our website so that you can practice looking for data on your own. But this is the Health Data Navigator page. This section is going to show you the relationship between the social determinants of health and the health outcomes that I shared with you earlier. We did have it so that the indicators are written in the positive. So meaning that the correlations that would lead to a negative outcome were reversed for the index. So for example, having a higher median family income is associated with a more positive health outcomes. And the same thing for education. Having a higher education is related to having higher health outcomes. But when you look at air quality, for example, you want a lower air quality index, which shows the amount of pollution in the air, to be related to a higher health outcome. So we reversed that to make sure that the relationship was in the positive. So that this section of the website shares a little bit more about that with you, and you can dig down into that later. So as you scroll down, you'll see, you'll see again another reminder of the social determinants of health. But then you get to this spot, which is explore health equity in your community. You can get there a little bit faster if you click on that little search by county where Alina's got her mouse hovering right now, but we just wanted to show you some of the things that were in there. So here you would just start typing in your county. And when you start typing, it's kind of auto generates the counties of Colorado. So it did seem like at the beginning we had a bunch of people in Pueblo, so that was perfect. So we'll go and click to Pueblo. And what you'll see on your screen now is a map of Pueblo and Pueblo County. So what's nice about this is on the back portion of this, you can actually, if you scroll in and go in pretty narrow, you can see Alina clicking on the plus sign to go in a little bit. You'll start to see streets, neighborhoods in the overlay or underlay, I guess it would be called. So if you're trying to look, for example, where you live, you could probably find some kind of a landmark to help you find that. What you see is on the right side for Pueblo County, you'll get a snapshot of data on race and ethnicity, and it's a slider. So if Alina goes to the next slider in that sidebar, you'll get to see age. We're going to be adding a few more demographic informations here in a future iteration. We're wanting to, for example, show education by ethnicity, race ethnicity. So we're kind of going to just create more so that you could get a little bit more data right at your fingertips. All right, so Alexis, yes, the breakdown is by census tract. So as I mentioned earlier, we wanted to make sure we had, and we're using data sets that has everything available at the census tract level, because that's what we are hearing from communities, is that you need, they needed more granular data, but we knew people wouldn't know where they live, like their census tract number. So Alina, if you click on one of the census tracts, you'll see the stats pop up. And so on that right little panel, you see it says census tract ID number 810, you know, like this whole like long number, which we know no one knows, which is why having it on a map is super helpful. We've gone through a process with our partners to also try to include neighborhood names when that is available. And like, we're trying to figure out how to put a little, I don't know, a space on our website where if you live in this area or know census tracts, like what the neighborhood name is, we'd love to kind of crowdsource that information. There was another project that had done that for some counties, not in Pueblo though. And so we want to figure out a way to kind of get more neighborhood names in here so it's even more accessible. But what you can see as Alina clicks on some of the different census tracts is that you can see some pretty big differences pop up in neighborhoods, sometimes that are just, you know, like one boundary away. And I know that when we talk in public health, the difference of like 10 years life expectancy in one neighborhood away can be shown by like looking at some of these stats. You can also see some of the disparities that exist in those metrics that are at the bottom of the screen. We've got education. What the metric is having a bachelor's degree or higher for those 25 years old or older. We have the median family income, and then we have the outcomes of average life expectancy and self-reported good health. We put education and median family income in there because those are the two metrics that are most highly correlated with the health life outcomes that we have here. A couple other things to note on this screen is that at the bottom where Alina is at, we wanted to have some kind of comparison. So what we've done is we have the state average included here. And so when available, we'll show whether the value is, what the difference is, either positive or negative from the state average. So some tracts there is missing data, and so that gets noted with just kind of a dash mark. And I think that's all I wanted to say about this screen, Alina, unless I've missed anything.
I think the only other thing is the racial diversity of residents was a really important aspect of this program. As mentioned before, we are looking to build out some of the race ethnicity data that we have specific to some of the education, so some of the indicators, including education and family income. That's in just recognition that while racism has necessarily been something that's been included as a social determinant of health in textbooks or anything like that, it does have a huge impact on our communities and on our health outcomes as well. So right now, that's kind of how we are learning a little bit more about what differences there may be in terms of racial, ethnic richness in each of our different areas.
Great, thanks, Alina. So we're going to invite you now to go on a little scavenger hunt. So hopefully if you're in front of a computer or I think people can navigate this on their phone. I haven't tried it recently, but it should be something you might be able to see on your phone. It'll be a little difficult. But what we'd like you to do is to go to the website. Again, it's just Colorado coequitycompass.org, and click on the Equity Data Navigator portion of the website. And then after you're in the Equity Data Navigator, go to the search by county link, and ask you to go and maybe look at the neighborhood in which you live, or the neighborhood in which you provide services, or a county that you're interested in learning more about. So we have a campaign called Did You Know? So we're going to ask everyone in the chat to share a little Did You Know fun fact that you can pick up by going into the Data Navigator and searching in your neighborhood. So we'll give you about 2 to 3 minutes to do this, and then share something in the chat that we can all learn from.
One other thing that I can highlight while you all are doing that is if you do go into, say, a county that you didn't mean to go into, or you would like to look at another county, maybe you work in one county, live in another, you can also search for that here, and you can do a quick change in a very similar way to how you searched by county before. Pretty much anywhere you see the little place icon with a change button on it, you can change into another county. So I just changed Jefferson, and I can change to Denver. I saw those two come up in the chat, and similar with Gunnison as well.
Great, thank you, Alina. And you can share a Did You Know fun fact either on an entire county, or if you can find your neighborhood, feel free to do that too. And I just put in a little Did You Know right now. Thank you, Erica. She put in a Did you know that in Arapahoe County, 86% of adults self-report good health? Allison sharing, wow, I was really surprised to see the 80,000 median family income disparity between my neighborhood and the neighborhood just north of me. Yeah. Veronica is sharing, did you know that Elyria Swansea, there is a population of 6,626? Yeah, we forgot to note that total population that shows up in the county. We have some interesting differences across Colorado, where in some counties, like the entire county is a census tract, right? Because there just aren't as many people under there. And so it's always fascinating to see those, like, oh yeah, Alina's going to Saguache County right now, where I think you might see 2 census tracts, right? And so it's just fascinating to see the way our state is divided up. So Lindsay has shared, did you know that under social determinants of health services, it's the only county, that's the only category in Pueblo County that is above the state average. Yeah, so Lindsay, you scrolled down a little bit and got to the tree, which we will talk about in a minute. Just curious if anyone else has any other did you know fun facts that you might want to share with the group before we go on. it's kind of fun poking around this website, I will share. You just kind of get into some parts of Colorado where you're like, wow, had no idea. So many of you are finding the more detailed metrics. So did you know a banana in Douglas County costs 51 cents and in Prowers it costs 64 cents. So at first we were really surprised when our data partners were like, we're putting in cost of bananas. We're like, why are you putting in cost of bananas? But it is an indicator of food prices. And so that's what they use for that, to help us understand what are kind of some of the food costs, high costs, as you're seeing that Talitha shared, that it's more expensive in one county than in another. And Grace is adding in that a banana in San Miguel County now costs 86 cents. So, you know, we'll find the county that has the most expensive bananas pretty soon. So anyway, it's just an interesting way to look at the data and to be able to have it really visually appealing and accessible for you to be able to explore. No one, if you've worked with census data, no one likes using those like tables and nested tables of data. It's so hard. And this just kind of makes things a little bit easier to go through. So we are interested, as Alina is noting, in seeing some changes over time. We're still trying to think about how we would display that on this kind of platform, but because we'll have the historical data of census tract information from 2017-18, and now we're updating it with 2020, we know that there are going to be some really big changes, definitely in income, in housing, built environment, and so it'll be interesting to see what the site shows. Okay. Yes, it is. It's combination census. It's mostly American Community Survey data. But Alina, is it, or is it mostly census?
I believe it's mostly American Community Survey.
Yeah. Okay, and thanks for answering in the chat. All right, so let's go on to the next part of the other area that we wanted to highlight for you. And some of you found it already, great. So here's what we call our tree graph. And so this just shares this is the part of the navigator that shows the 17 social determinants of health that we mentioned. They're organized into these 7 areas of economic, education, environment, and so on, and put into an index score so that they can all be compared on the same scale. So that's why on the bottom, you see it going from, like -1.4 to 1.4. In the very middle is the state average. And so again, this is another way to have a really quick glance and see how that county or that census tract is doing in comparison to the state average. And so then when you click on one of those sections, you can see the actual metrics that are going into that index score. And so some of you were already looking at, well, here's housing, economics. So you can see the percent of people 18 to 70 years of age who are employed, what the median family income is, and what the change in poverty level is from 2012 to 2017. So again, that will be updated, and I imagine we'll see some very different data when that comes into play. So you can look at any of these 7 areas and see, how the county is performing, and see what the particular metrics are that are making up each of those indexes. So what you can see here in Pueblo, and there's that food price of banana, 64 cents there, and then the access to healthy food. So meaning that you're within a 20-mile radius for the rural census tracts and 1-mile radius for urban census tracts. So we know that having access to healthy food is also associated with more positive outcomes. But at quick glance, what you can see here is that county performance. So if you go back, Alina, you can see that for Pueblo County, health services is the one area where the county is above the state average and is below in the rest of them. And so scroll down a little bit more, Alina, and then the other thing that we have on the site are 5 key factors. These are the factors that have the greatest association with positive health outcomes. So what this means is that if these 5 factors for Pueblo County, it's higher ed, median family income, access to a car, percent employed, and households not housing cost burdened. I always get like a little tripped off with the way that's framed, but it makes sense eventually. But these are the factors that affect health outcomes the most. And we have this data only for the 10 largest Colorado counties. That's where it was available for all the tracks in those counties. And so for the other 55 counties, what we show are the top factors for the state. So again, that might change with the 2020 update, but this is something that we thought would be helpful for community members as they're going into the site to know what are some of those key factors that we should focus on. Okay, so then let's get over to this way to compare counties. And that's a question that Grace just put into the chat. So good timing, Grace. There is a way to compare counties. There's also a way to compare census tracts within census tract, like to another census tract, or a census tract to the county. So what you would do is this little area here is that you would type in either another county that you might want to compare it to. So it looks like Alina is going to compare to Gunnison County, and you click there and it'll compare to the last thing you had up. So here what you'll see is Pueblo County, huge population difference, 164 versus 16,000 in Gunnison. You can get a quick glance at the bottom and see some of those stats where you can see some real differences in education percentages, also in family income, as well as in those health outcomes. And so really interesting to look at those differences. And again, you can see the racial diversity of residents being different there. If you scroll down further, you'll see what was the tree graph information now put into this radial wheel. So that you can see the comparison. So red is Pueblo County, the green, the turquoise is Gunnison, and then the state average is in yellow. And so this can give you a real quick glance to look at where are these two counties in relation to each other, as well as in relation to the state average. And then that information is all available down below with the click on the plus sign so that you could be able to see side by side what the data looks like. So Alina, we're doing that for a county to county. Let's share with them how to do a census tract within a county. Like we've gotten to be quick at copying and pasting census tract numbers because there's no way you're going to ever remember that. But there's an 8010092, I think, census tract number, Alina.
Sorry, could you copy?
Yeah. Let me grab
it's hard with sharing screen.
I think it's 8010080. Oh gosh. Okay, hang on. Let me grab one really quick. I gotta go into it and look. Pueblo. So there's a lot of going back and forth right now with like looking at census tracts, grabbing a number and then copying and pasting it just so that it's a little bit easier to, here's one, 8101003500.
I'm sorry.
Okay, I'm going to throw it into the chat.
Okay, that will be helpful. Thank you.
Okay, I put it privately to you. And then while you're doing that, Trina has a question around, can we compare all counties in one category at the same time? For example, which county has the highest median annual income? So there isn't, currently our site only offers the feature of comparing two things to each other. But what we do have available on the website as well is the ability to download the entire data set. So you can see that Alina just clicked on that, like download data. It's not visually going to be all that pretty. I think it's an Excel sheet. And so, but Trina says that's even better. Okay, great. So you could have all that data and look for yourself. But then if you want to have a visual snapshot of it, you can like compare the highest one to the lowest one after you found it on the table. So here you can see a comparison of a particular census tract in Pueblo County to the entire Pueblo County. And again, this just kind of highlights that need that community members have around wanting to know what their neighborhood looks like, because the county data isn't reflective. And you can see that here, especially with education and median family income, and a slight dip in life expectancy also. So it just allows you to look at neighborhoods in a more granular way. And Trina is just saying, yeah, you don't mind data cleaning. That's great. Unfortunately, right now, there is not a way to combine census tracts. You know, that would require quite a bit on our team in terms of creating, like how to create, well, creating the formulas to do that, and then the mechanism in which to do it. But thanks for asking that question, because I think your questions are helpful for us to understand, well, what are people interested in, right? And so what might we look at to do in our, you know, Colorado Equity Compass 2.0 or 3.0. So we're always looking for ways to improve.
Oh, and Rachele, I just wanted to kind of jump back into earlier parts of the chat where people had some questions about the indicator selection. Valerie was interested about why bananas rather than bread, milk, or eggs were chosen.
Good question. That is probably more for our data team. I think it was the indicator. I mean, oftentimes it is because it is the indicator that is available for all census tracts. And so my guess is that's the reason, although I would be surprised if like some of those other food products that you mentioned would not be available as well. But
and then Riley wanted to know if you had information about how it was decided that access to healthy foods was 20 miles for rural census tracts and 1 mile for urban.
Oh, that's a good question too. I don't know how that one was calculated, but Allison, do we have a way of saving all the questions, right? Or downloading?
Yeah, we'll save the chat.
Yeah. So we're happy to look into that. I think I mean, as you would guess, we obviously wouldn't want to use the same metric for a rural county and an urban area, but I'm not sure how the 20 miles was determined. So we can look into that.
Thanks.
Other questions, Allison? Before we go on break, we wanted to make sure we gave people about a 5-minute stand up, stretch, bio break.
I think that was all I saw. Let me know, Jessica, if you saw more that I'm missing.
Okay, yeah. And if somebody's question was not answered, because there were a lot.
Oh, yeah, please feel free to
feel free to send it in again, because I want to make sure that we get to your questions.
I may have missed this one, but there was a question that asked what factors are considered to say that yes, there's access to healthy food, and what constitutes healthy food for the purposes of these data.
Oh, those are good. Like, there's a lot of people in food systems here. That's great. Okay. So sorry, Jessica.
No, sorry, I read that really fast. So first part, what factors are considered to say that there is access to healthy foods?
Okay. So the first part is that it is, Alina, correct me if I'm wrong. I believe it's that it's a grocery store. Like, one of the things that we found in working with Southeast Colorado was that many of the people there thought that they lived in a food desert. And so what they were able to do was to leverage the data that we helped them collect to notice that we're actually not in a food desert, but they were in what was the other term they used, Alina? It was like a food swamp. A food swamp, because they had like a lot of the dollar fast food kind of like
liquor
stores versus a grocery store? So that's the first question, Jessica. What was second?
Yeah, sorry. And I think it was just a clarification. Miriam, if I misunderstood that though, and you did have a different question, please feel free to put it in the chat or come off mute and clarify.
Yeah. We're a small group, so feel free to unmute.
And I believe that's that one is sourced from census data. So it would be however the census is defining healthy food for the purposes of the question as well. We know that we're actually very involved in the food system here in Denver and evaluating that as well. So there is always a question around what actually constitutes healthy. And we know that there's a lot of disagreement in the food system, even about how to define that. So for the purposes of this, we are kind of beholden to what is available through the census data there. One of the other things that we are interested in doing more, and we're hoping to provide in a future iteration of the platform, is actually access to some more local data sources as well. So say, as I mentioned, we're doing some work in Denver County, and we know that there is a lot of food specific data in Denver. We might not necessarily be able to incorporate those kind of smaller local data sets into the full index or into the full platform itself. But we might be able to have those data sets available on, say, this specific page that has Pueblo County data at kind of this broader level. And then here might be some data sets that you might be interested in looking in deeper as well. So that's something we're hoping to bring to this platform as well.
Yeah, for sure. And so if your county or region has access, we haven't figured out what our call for data is going to look like yet, because we're trying to figure out how to incorporate it onto the platform in a way that is still accessible and easy for folks to get to. But we're always looking for data sources or reports or things that are locally sourced. Would be great to have on here. So, okay, let's take our break. So Allison and Jessica, 5 minutes, right? So about 2 minutes after that. So 3:32, sound good?
Yeah, that sounds great.
All right, thanks everyone. And we will come back online then.
Yeah.
Hey, Allison, we're slated to end at 1:45 then so that you have your time, or are we going a little bit longer?
Yeah, just because you're integrating like the question and answer period so well. Yeah, we can, we just need like 3 minutes to kind of close out the session.
Okay, and we're closing on the hour, right?
Yeah.
Okay, great.
All right. Just wanted to bring everyone back to our session since the 5-minute break is over.
Great. Thank you for making sure that we incorporate that opportunity. We know how it is to be on Zoom all day long. So, all right. I think what we're going to go into next is we want to share how some of the community stories have been populated on the county page. We'll use that for El Paso. And then we'll dive into how other communities are sharing some of their own stories and how we're gathering those into our resource bank as well. So after the tree that you saw and you scroll down back there, what you'll see is we have a space called Community Stories and Voices. And so this is where you will see some things related to this particular county of stories that have been collected. And so you can go, and then many of them often come from outside sources. So there will be a direct link. I think the advocating for homelessness in El Paso County or in Colorado Springs, I feel like that might have been one of our story. No, it's not. This is through Catholic charities. And so some of what you'll find are stories that are already curated by other groups. Some you'll find the Daily Dose actually was in Southeast Colorado Springs, and was one of the pilot communities that we worked with. And so they received some support from us in order to create the short video blogs that they had created. And so this is where we're really hoping to engage others in collecting more community stories and voices, because we feel like it's a way to empower communities to be able to tell the narrative that they want to share about their own community. Sometimes, as you all know, data doesn't always reflect the experience of a particular neighborhood or community. And so we want to make sure that we're highlighting and giving voice to other perspectives as well. So we do have a place on the website where you can share your story. We most recently also awarded $2,000 small grant awards to 20 communities across the state of Colorado to help support them to tell their stories. They can do it either through a video, through a blog, through an article, etc. And so Alina has now gone into the resources portion of our website, and we have under the content filter a place to look for community stories. And so you can find these here. And they're also tagged by different, Alina, if you can just open up the content filter on the left, you can do different kinds of searches by categories and selections. And so you just have to remember to unclick, because sometimes I get to the point where there's 0 resources. I'm like, how did I get here? It's because I had too many filters on. So again, we also have a call out for resources. If there's something that you want to share with us, feel free to share those resources with us. We're really trying to highlight also more data sets that are publicly available. So if you have data sets that you want to share with us, feel free to pass those along too. We really want to be a resource to the community. Alina, anything else you want to add in or that I missed around the storytelling?
I don't think so.
All right.
We will get more on the website soon. As Rachele
Yeah.
mentioned, we are engaging those 20 organizations right now, but they're still in the kind of development stage of a lot of their stories.
Yeah, we expect that we'll have all of the stories submitted, and each awardee was asked to submit 5 stories on their health equity work. And so, you know, we'll have at least 100 more stories up on the website by the middle of June. So be on the lookout for that. And we've also had communities ask if we'll do another set of awards, which we are certainly into looking into. And so we will, if there are more communities that need support to tell their own stories, we're happy to kind of consider that as well. All right, so now we want to get into another resource that we have on the website. In our work with the pilot communities, what we found was they needed help around how to use this data to tell your story. And so we looked at the processes that we were going through with the communities and have provided an interactive tool on our website to help you walk through some of those steps. So Alina's on that space right now, using data to tell your story. So we've outlined 6 different steps that communities can go through. And this is actually in your own work, in the worksheet that we shared with you. We shared these 6 steps with you and offered you space to do your own work or on what the story is that you're trying to tell and how you're trying to involve community in that process. And so we'll kind of tie this back to the platform so you can see how to use this tool and the platform and the resources on the Equity Compass to help support your process. So sometimes we know the story we want to tell already just because you've already been engaged with community. And sometimes you need to find out, is there a story that the data wants us to tell? So there's different ways that people come to figuring out what the story is. And on this platform, what we do is we offer some resources. So you'll see that we, for example, have a resource around the social determinants of health. And we also have encourage you to go to the Data Equity Navigator as a way to find out what might be of challenge right now. So you'll usually see a resource with each step or a few resources, and then some ideas for community engagement. I will say that community is at the center of a lot of the work that we're trying to do. And that's why we engaged pilot communities to help us with the development of this. And we really want community members to have access to this information. So we provide you with some ideas on how to engage community in the process. So then the next step is around finding existing data. And so this is where, yay, we hope that the Data Equity Navigator is, it's data that's available to you for free. And it's like, we think it's pretty accessible. We hope you do too. But then we also have other data sources, as I mentioned earlier. So if there are other data sources related to the social determinants of health, we've been trying to identify those for you. And again, this is kind of work that's always in progress. If you have a data set you love to use, let us know. I think we were on a call with another community a while ago, and there was a woman who worked in the oral health area. And she was asking us, well, do you have any data around that? Like that should be part of overall health, which was a great reminder for us. So now we're looking into, what kind of data can we find for oral health? So if there's a gap and it's something that we can fill, like at the census tract level, though, that's always our challenge. We're happy to look into it. So let us know, like if that's the next step, actually. Determine the data gaps. If there are things that you are interested in, but you're not finding, and part of our role on the Compass is to try to help communities identify how they might get data that isn't there for them already. So we do have some tools around data collection, survey toolkit, focus group toolkit, and again, encourage you to think broadly about what data is. Sometimes we tend to lean on the quantitative data, but know that data can be pictures, it can be videos that are collected from people. So to be creative around what kind of data you might want. And then the next step is around making meaning. Once you collect all that data, how do you make meaning of it? And so we have a couple resources around that. And again, this is where community engagement we feel is so crucial, because community can give, insights into the context of the neighborhood or the regional area. They might interpret the data in a different way or provide some, other factors that might be influencing it. So we're really big proponents of kind of really using an equity lens in all parts of this process and making sure to engage the people who are most impacted by the data that you're looking at or interpreting. Okay. And then the next step is how to gather some of those stories once you've identified what a focus area of focus might be. And so again, we have a couple of tools on our website on data storytelling. We have some on like what's a structure for a good story. And so, you know, feel free to look in our resource database for things that can help you with that. Also want to help you think about like where to share your stories too. So to think creatively around how you might approach that. And the compass, again, is available to you as community members. If you're interested in leveraging our platform to share a story that you have, we're happy to do that, and to do that through our own social media channels, et cetera. So, you know, feel free to reach out to us. We'd love to partner with people around elevating the different stories that you're collecting as well. And then that last step is kind of bringing it all together. So we do have resources on how to do the marrying between the data, the story, and visualization. So we know that visualization is, Alina is amazing at visualization. So it's great to have her skill set on the team. And there are a lot of really good resources on how to make data, well, how to use an equity lens as you're thinking about how to share your data, as well as how to pull it together into a story. And again, the community engagement part here is that it's so powerful when communities tell their own stories. And so encourage you to think about how you build up the capacity or share resources or tools with community members so that they can tell the story of their experiences in their own communities. So that's the tool set in the document. And Jess and Allison, is it just something that participants are able to download from your platform?
Yes, it's currently loaded into Sketch right now, so you can download it anytime.
Great. And then in that worksheet, what we also did, in addition to these 6 questions, we also just shared screenshots with you of like how to get to the different points on the equity data navigator so that you can make sure so you remember how to get around there and to find data. So Alina, anything you would like to add?
I don't think so. Maybe the only thing is that it's still a new tool that we're working on, kind of adding more resources to help support around that, like telling your data story. The other thing that we are very passionate about with the Colorado Equity Compass is that these stories actually help to create some action as well. So that is a next piece that we're hoping to have available on the website soon, is kind of a call to action and who might you contact, who might you get involved with, what other ways can you share your stories that could help to make impact and sort of develop some change that you want to see as well. So I don't have anything yet to preview for you all, but that is something that we're looking forward to in the next couple months to bring out.
Yeah. So that call to action will actually be available on in the equity data navigator. So as people look at a particular county or region, the call to action will be linked to a database that we have of community-based organizations in the state of Colorado. So we have them all tagged by region or if they're statewide, et cetera. We're also tagging that list to show kind of which social determinant of health or what sector that organization might be working in. So it's a way to kind of just increase knowledge about who's doing some of this work. We're also going to have a link to people's representatives, so that if they want to outreach to their congressperson or to the House rep person, they will have that information right there in the page. So those are just some idea or things that we've been thinking about, ways people can use this data for action. So the questions have slowed down. Just curious if anyone has any questions around the tool, or we can go back to the navigator if you would like to, or we'd love to hear from you around work that you're doing, or a question that you might have around the tool or the data set.
While people are thinking of questions, I was just wondering if you've done any Google Analytics so far and just like what parts of the site are people using the most? And yeah, it's just such a comprehensive resource and I'm just kind of curious about that.
Yeah, Alina can answer that better than I can. We do have Google Analytics on some of the pages so that we can track. You know, we did a soft launch of the model. God, I think last year we soft launched in at the beginning of 2021, and we actually presented, our colleague presented at the culture of at this conference last year in collaboration with one of our pilot communities. So Alina, is there anything you'd add in terms of any nuances in site visitations or pages?
Yeah, I think there has been a lot of interest in both the Equity Data Navigator as well as the resources on the website. We have gone through a few different kind of iterations of how one navigates the website. So there's a little bit of nuances in our data on our Google Analytics data. So there was also a lot of interest in the work that was done in Southeast Colorado Springs, which was actually presented on last year's Culture of Data conference. So we did see a lot of interest in that one as well. But yeah, I think it's just been interesting to see what folks have interest in. And one of the big things right now actually is resources around like using data to tell your story or finding additional data sources. So those kind of main areas I think that we have seen traffic on our.
Yeah, and then I'll just add too, and would invite participants to ask us as well, like given where you're doing your work, what are some things that you tend to look for as you're looking at data? Because we do, you know, for example, we are enhancing the data set to include a mental health outcome, given kind of our current context and in recognition of the fact that, you know, after 2 years plus in a pandemic, you know, the mental health needs of communities are increasing. So that is one enhancement that we're going to be putting in as an outcome in that blue bar that's going across the bottom, so people can see that. We're still deciding on which metric to use for that. And then the other piece that we're charged with is supporting communities around this use of data for action. And so we've been hearing a lot of interest in housing. No big surprise there. I mean, people are having to move out of their houses or unable to afford payment for rent or mortgages. And so there are a lot of groups that are working on housing issues in the state. And so we're considering maybe pulling together a group of interested organizations that want to work in housing data to maybe have some kind of a community of practice that would help support their work and allow for some peer-to-peer connections across the state. So, you know, if there's something that you're interested in and want to find other people to work with around that could be a mechanism to help support the work. There was a question in the chat about when the 2020 data is going to get up, and it is going to be a couple more months. There were delays in the release of the data, as I'm sure many of you know, and so that's just kind of pushed back our time frame as well. We're just like eager to get that up there as much as you are to see it, I'm sure.
Oh, that's great. Yeah, just that you guys are budgeting in time to maintain this resource so it continue to be of use to communities.
Yeah, Allison, we're at the, you know,
yeah.
In terms of that update portion, you know, we're obviously dependent on when data becomes available by the other parties, right? So for ACS, we also leaned on some Colorado specific data that was collected, but some of that data is only updated. It's also updated, not necessarily annually, but sometimes every other year, et cetera. And so, you know, we just have to kind of keep track of when new data is released. Any other thoughts or questions from participants?
I may have missed this, but I have a question about the community stories, which I think is so great because for a lot of us who do data collection, trying to figure out how to share stories and especially qualitative data in combination with those quantitative data can be really challenging. And then to have really some authentic stories from folks. I'm wondering if, I may have missed it, so apologies if so, if there's a way to connect the stories to the location of that community, if it's in the map.
Yes, there is.
Okay.
So if you're in the map, and Alina's showing it up right now, the community, if there is a story from that community, it will pop up at the bottom. And so we are tagging them by region, and in that submit your story section, I don't know, Alina, if you might go into there actually so people can just kind of see what we're asking people for. It is, oh, we're not accepting any, this is not true. So we will change that.
Yeah.
Oh, it might be because we are actually trying to integrate it more into our website versus being in a Google form. But I think we should have the Google form should be up and running. So we'll look into that. But we do ask the submitters to indicate their region, kind of what the focus is in terms of categories, so that those stories are easily accessible for people to find.
Yeah, I was kind of curious in that resource section if there's a way, and I may have missed it again. This is so comprehensive and amazing. Is there a way to look by region or that in the resources as well, or look at maybe a map to see like the community stories and where they all are?
Ooh, that's interesting, Jessica. No, that's not a current option, but the idea sounds really interesting. Yeah,
we've talked about adding onto the filters here the counties. I think it would be a lot to have each of the census tracts, but for counties at least, we were talking about having a place-based filter as well. And actually, one of the newer things that happened just this week was that we now have access to all of the stories historically that have been added onto the website. So we're still kind of figuring out in which ways to display those, both announcements that we have on the website on the front end, and then also the stories as well. So there is a possibility maybe to build out something that could be kind of place-based or map interactive as well. I love that idea.
Yeah, thank you, Jessica. I'll also share that we're in the midst of doing a pretty big public awareness campaign around the Colorado Equity Compass. We were hoping to have 2020 data in it already. And so that we pushed back on the big campaign because we know that some of the data is going to just change dramatically. As I mentioned earlier, probably around income and housing and some other things. But we do have like these Did You Know campaign that's happening, kind of regional specific stats that we're doing outreach to right now, like local newspapers or local publications. And so invite you all as participants, if there's anything that you want to make sure we're highlighting in your neighborhoods, feel free to reach out to us because we want to make sure we're sharing more about the site and encouraging people to use it. There have been some unexpected uses. Let me just share a couple. So one, there was a group of Asian American Pacific Islander residents who were really interested in the impact of the changing of the voter, what is that called? Like the lines.
The redistricting process.
Yes, the redistricting process. And so they used the data in the Colorado Equity Compass to create maps to show how some of the redistricting would split up people of color from each other. Yes, Miriam, gerrymandering. And so they really leveraged this data to have a visual so that people could see, well, if you draw your line this way, you're taking this group and splitting them away from another group, et cetera. And so it was a pretty powerful way to use the data. And so we've been excited because there are just some unexpected ways that communities are finding the way to the data. We've heard of parents finding this and using this to help with some of their, moving situations, like where certain factors are important to them in terms of where they live or the schools. So anyway, that's just there's some creative ways that the data has definitely been used and being leveraged for change.
Oh, wow. I feel like citizens using data to like push back on like redistricting is like the ultimate example of like democratizing data. That is just so cool.
Yeah, absolutely. So housing and voter registration, I think are the housing we're definitely updating the data set with, and mental health as well. But we've also heard from others around having more information on voting. And so maybe given that we have a map platform under here, kind of looking at, well, what's the proximity to voting, voting station, or to what is the percent? I think we have the percentage of people who are registered voting, right? Yeah, we do. So under social, we have registered voters. So you can see that. And then we also have this metric around engaged youth, which is, I think, another interesting metric to look at. So definitely encourage you to kind of look at all these different metrics that we've got under here. Some of them sometimes still surprise me. I'm like, oh, I didn't realize we had that. And so it's always fascinating to see what's in here. And in our work with the Colorado Health Institute, we're always going to be looking at ways to enhance and add in more information.
Oh,
yeah,
excellent.
one of our favorite ways of doing that has been we've been doing ad hoc trainings for folks on the platform, and just within those conversations that we're having with folks more about what kind of metrics are of interest to those outside of who we've been able to work with previously. And there's always there are always different perspectives that we wholly welcome into this work. And really this platform is meant to be in service of all those in Colorado who are interested in data, or who maybe don't know that they're interested in data, but find this really accessible. And so that's something that we're really excited about. And as we've said multiple times throughout this is a continually updating and reforming kind of platform that we're doing, all in service of that kind of, how can we best use it, not just us, but we collectively use this to kind of move forward this health equity things that we're so that are so important to our lives.
Yeah, thanks, Alina. And we're also available to do trainings. So what we have found is that groups find it helpful where we can walk through if there's a particular focus area that you're more interested in, we're happy to do kind of more of a tailored training, or if there's a particular region that your group or a network is working on that you want to dig into a little bit more, we're available to do some more targeted training with community groups as well. Sorry, Allison, I think you were going to ask or say something.
Oh, yeah, that's great. Kind of like wrap up informations if people want to like take this to the next level. And I just wanted to thank you both so much for being here today and presenting this resource to us. Have a few announcements before you all head out for the day. As we mentioned, slides and any additional handouts are going to be available on Sketch. And actually, I'm going to coordinate with you, Rachele and Alina, just to make sure that I have the most updated handouts, since I don't know it had all of the information that you listed. So if it's not there now, it will be there later tomorrow. And additionally, you'll receive a conference evaluation form via email once the conference is over. And we really appreciate you are taking time to give your feedback. And and if you complete it, you have the option to opt into a raffle to win one of two $50 gift cards, just to thank you for your participation. And then we wanted to make sure you guys join us back tomorrow at 9 a.m. That's when our plenary session is scheduled to happen. And we will be hearing from Dr. Harvell, who will be presenting on community health and the pandemic response in Colorado. And after that, there will be some more breakout sessions. So I just wanted to thank you again for attending this conference, and also to our speakers. Yeah, it was a really great afternoon session. Thank you again.
Thank you.